Welcome back. This is the final installment of my hysterectomy / excision surgery journey. If you have no idea what I'm talking about, there are parts 1 and 2. They will be linked down below. I'll also put cards up top so that you can click and watch those. Part 1 discusses why I'm having an excision surgery and a full hysterectomy for both endometriosis and adenomyosis. And then part 2 talked about some of the prep stuff that I did beforehand. Part 3 is the aftermath. I've had my surgery, I'm healing now, and I wanted to talk to you about everything that's happened over the past 6 weeks, which has been a lot. So this is gonna be a pretty lengthy video. Of course, if you have other questions, I can either film another video or I can try to reply to you in the comments below. You can also find us on Instagram. If you're not already following us, we're at our time of the month, just like we are here. And I have an entire highlights reel saved on our main feed that's called Hysterectomy. And I feel like that is such a great real-time resource for you because in the moment, as I was healing and recovering, I was documenting most of that process on Instagram in stories. And so I saved them all into a highlights reel. My surgery was on October 28th. That morning, Mike and I arrived at the hospital around 9 a.m. I had a pregnancy test just to make sure I wasn't pregnant. I got my IV and all of that. They actually did it in my hand, which I had a really big aversion to, but then it ended up being one of the best IVs I've had because I was able to move my arm so freely. They prep you ahead of time with some pain relief. It's not a narcotic, but it does just sort of help to kind of relax you a little bit and also start to get that pain relief into your system. I had great nurses, great operating team. My team was all females, which I thought was so badass. So my surgeon, all of the people on her team were all women. My anesthesiologist was a woman. It was a great experience all around with that. They all made me feel really good. I was obviously very nervous. That's totally normal. But once I got in there and I got my IV done and they piled warm blankets on me, I started to feel better. And they did let Mike come back and sit with me up until the very last moment when they wheeled me away. They explained everything that was going to happen and asked me if I had any questions. One of the big takeaways from that initial conversation with my surgeon day of was mostly about pain management because I am allergic to a lot of narcotics and I have really poor reactions to a lot of medications in general. The doctor and I had a discussion and we decided on Dilaudid, which is like hydromorphone, and it's a heavy hitting drug. It's, nothing to play around with, and obviously addiction is a concern, but I knew that I would need something to help kind of get me through at least for a couple days. And I'll get more into that in this video, but I only ended up needing that for a very short time. I didn't even finish half my pills. I remember getting into the operating room and the table being really narrow, and I thought, how the hell is that table gonna hold my body? So I remember getting on there and the anesthesiologist injected something into my IV and I was still very much awake, but I remember feeling suddenly better. And I was like, did you give me something? And she was like, oh yes. So she gave me that happy drug. We talked for a few minutes and then I remember nothing. I woke up 4.5 hours later kind of thing. So I woke up in the PACU and my nurses in there they made me feel like a queen, like a princess, like I was the only patient that they had to worry about that day, which was not at all the case. But I remember waking up and thinking, I'm in so much pain. I knew that I would not feel good, but I didn't expect that kind of pain because to me, the pain I was feeling immediately when I woke up was like the most horrific, heavy-hitting period cramps. And that to me was really confusing because I was like, I just had a hysterectomy. I'm trying to rationalize in my brain. My nurse is like, hi, Sleeping Beauty, how are you feeling? What's your pain on a level, on a scale of 1 to 10? And I was like, it hurts really bad. I think I'm at a 7. And she was like, well, you still have fentanyl. We can give you more of that. And I was like, okay. And so I felt like I was so in and out of consciousness because it does take me a really long time to come out of anesthesia. But I felt like every time I was talking to the nurse, she was like, we can give you this, we can give you this. And I just was like, okay, get whatever it is, I want it, because I was in a lot of pain. It was considerable. I do remember my surgeon beforehand was like, I'm not going to see you until your post-op appointment because when you wake up, you won't remember any of the things I tell you. So I do remember my PACU nurse being like, your surgery went well, she removed a lot of endometriosis, and she took your uterus and some cysts off of your ovaries, but you did keep your ovaries. And I do remember that conversation. And I remember when she said she took out a lot of endometriosis, I immediately wanted to cry, because up until this point, you know, I had no idea that it was confirmed that I had endometriosis. And so I've lived this life of pain and just discomfort, and having never really known that that was the definitive diagnosis, like obviously it's a mind fuck a little bit. And so to wake up and hear that news, I was like, okay, like great decision, you did the right thing, that's awesome. And she did give me photographs of the inside of my abdomen, and I remember being like, okay, like what the fuck am I supposed to do with this right now? So at this point, I'm still just in recovery, and it's late. I got to the hospital at 9 a.m. and I think at this point it's like 5:30 at night. I remember them telling me that my ticket out of this place was to pee. And before I even had my surgery, and when the nurses were prepping me beforehand, I remember the one nurse saying, when you wake up, they're gonna ask you to pee before you leave. And it can be hard for some people, but don't let it get you discouraged, and try not to overthink it. Okay, great advice, but I can't take that kind of advice. To me, I'm like, overthink it forever. I'm never leaving this hospital because I can't pee, kind of thing. So finally, it's like 7 o'clock. I'm still in the recovery room, haven't seen Mike. All of a sudden, I see this beautiful Barbie nurse. She's even wearing like this bright pink scrub outfit, and she's got gorgeous blonde hair, and she's a nurse. And she's like, I am not a transporter, but your husband has been waiting out there so patiently all day long, and he keeps asking about you, and so I'm gonna take you to the final recovery area, because they were really busy. They didn't have any transporters available to move my bed from point A to point B, because there are like stages of recovery, and so I'm only allowed to see Mike in a certain stage of my recovery. And so she's driving me, I'm still completely out of it, and she was like, your husband's been waiting and he's so worried about you. And I was like, oh, don't worry about him, he's a very patient man. And she was like, and I'm not a good driver, this isn't what I do, I'm so sorry. And I was like, you're doing a great job. And we're like clanging into the elevator doors and cutting corners, and the bed is bouncing everywhere, and I'm thinking, I'm so grateful that I'm like still out of it, because I feel like this would be like a painful journey. But she was wonderful, and I do appreciate her doing that. So I get to my second recovery room. I've got another spunky firecracker nurse who's a bit older, and Mike is sitting there waiting for me. I have to get out of this bed and then get into a recliner, like one of those recliners that goes way back. You know, she's like, okay, the trick to this is when you're sitting down, blow out, exhale on the down. And so I did that, and it was fine. You know, she's like trying to have this very serious conversation with me about post-op care, and I can't keep my eyes open. I kid you not. This is me getting my orders. And at one point she was like, I feel like you're not listening to me. And I was like, oh no, I'm listening, but I'm not retaining any of this. So obviously Mike is there writing down notes, whatever. So finally she's like, okay, we gotta try to get you to pee so you can get the heck out of here. Obviously I had a catheter during the surgery. Things are swollen. It's a long operation. They've done cutting and removing of things, and it's like really swollen and angry inside. So I feel like I have the urge to pee. I get into the bathroom. I'm feeling like I'm peeing, but I'm not peeing. I just have some blood coming out, which is totally normal. So she sets me in there for like 10 minutes, and she's got the water running for me, and finally I was like, I cannot pee. I was just feeling kind of discouraged and like, oh my God, something's wrong. Oh my God, they're not gonna let me leave. And so I kind of struck a deal with the nurse, and she was like, if you don't tell anyone, I won't tell anyone, kind of thing, that you didn't pee. So we sort of struck a deal, and Mike went to get the car, and then someone took me down, and I got in the car. And here's your first tip: get a car pillow. So if you watched part 2, I talked about this pregnancy pillow that I got, which is a godsend. Everyone needs it, man, woman, dog, doesn't matter. And on that pregnancy pillow, it has a straight arm that's detachable, and so you end up with this pillow that's, I don't know, 18 inches long and maybe 8 inches wide. So it's perfect for sitting in the car. So I got in the car, Mike put that over my belly. I did have a binder on. I had an abdominal binder at the time. Then the seatbelt got put over top of the pillow. And I will say the ride home was only like 15 minutes, but it was very painful. Like anytime we went over a bump, which, hello, we live in Baltimore City, there are potholes everywhere. That was unpleasant. So we get home, Mike helped me up into bed, so I had to walk more steps, which they say is fine if you have someone with you. I wouldn't advise like going up and down if you can help it. So I got upstairs, he gets me situated in bed. I'm at maximum pain. I honestly felt like the drugs they were giving me weren't touching the pain that I was having. It almost felt like it was so deep and so internal that there was just nothing that could be done to dull it. So the medicines that they gave me were Dilaudid, which is the hydromorphone, extra strength Tylenol, like the prescription version of it, and then ibuprofen, 800 milligram, and Zofran for nausea. I was very nauseous. I did get a seasick patch kind of thing put on me before surgery, and they injected me, and they put an anti-nausea medication in my IV before my surgery. I didn't end up throwing up, but I was nauseous. And that lasted for quite a while, days. So I was really glad they gave me the Zofran. Mike was waking me up whenever I was due for ibuprofen and Tylenol. And, they told me to keep up with those. Around the clock for the first few days, like really keep up with the ibuprofen and the Tylenol, take the narcotic as you see fit kind of thing. So that's what we did, and I do think that was good advice. I will say for the first couple days, I was accepting the Dilaudid, but I knew, it's very constipation causing and I already struggle with that, and B, I just didn't feel like I really needed it after a couple of days. So my surgery was on a Thursday. I was off of it by like Saturday night or Sunday morning, and I wasn't taking them every time I was due, but I will say keeping up with the others I think really helped. I have little notes here so I don't forget anything. Okay, so I get my medication, I'm in bed. The way that I slept was I took that pregnancy pillow, so I put that behind me and I had the long arm on my right side so that it kind of created a barrier in the bed. And I had intended to sleep separately from Mike, but I feel like me having that little barrier was really helpful. And also the first couple nights, it was nice to just be able to be like, Mike, I need X, Y, or Z. And I had my binder on, and because I was bleeding then, I had like a panty liner on kind of thing and a pair of underwear. I just felt really bloated, really, exhausted, in a lot of pain. And so I welcomed sleep that night. Mike woke me up once to give me my ibuprofen and my Tylenol, and then I think maybe like 2 hours later I ended up taking the morphine. I'm also at this time taking stool softeners because, just spoiler alert, this was the worst part. The constipation for me and the inability to urinate. Those were the hardest things. I'm not even kidding. The next day rolls around and I'm still finding it super, super hard to pee. I can pee a little bit, but it does not feel like I'm emptying my bladder, and it's taking me a really long time. I've got to have water running, have my hand in the water. Our friend Joy actually sent me some pamphlets and diagrams and stuff and tips and tricks of how to stimulate the flow of urine. She's a pelvic floor therapist, so she's this is what she does. But it was painful. It felt like I couldn't empty my bladder. I had to work for it so hard. And that lasted for a really long time. And even now I'm 6 weeks out, there are still times where I'm like, come on, pee, let's go. I gotta pee, let's go. Or sometimes it might just be there might be a little tinge of pain, which I've learned since then is normal. There was a time during this process where I couldn't pee at all. I sent a note to my doctor, who's extremely responsive, and she was like, I want you to come in first thing in the morning. We're gonna give you a catheter. Oh, great. I hadn't pooped up until this point, and I was doing everything I could to create a bowel movement. I'm drinking shit tons of water. I'm taking all the stool softeners. I'm drinking the Smooth Move tea. I'm taking magnesium. I'm drinking prune juice with butter in it. I'm trying all these things thanks to you on Instagram. Finally, I had a bowel movement. Once I had that bowel movement, first of all, I clapped for myself because I was so fucking proud. And as soon as I had it, I peed. It was like the first real stream of urine that I had. And I thought, oh my God, thank you, thank you, thank you, thank you. And I texted my friend Joy and I was like, oh my God, it happened. And then I peed. And she was like, but these things are so connected. People don't even realize how connected they are. So it was like once I had that blockage cleared, I was able to pee more easily. It wasn't a walk in the park, but it was certainly better than it was. And it did feel like I could finally tell that maybe I'd emptied my bladder. So I wrote my doctor a note and I was like, by the way, I pooped and I peed normally. And she was like, okay, monitor it throughout the night and in the morning. And if you feel like it's still better, you don't have to come in. I was like, okay, great. So it was, it stayed getting better from then on. A lot of people talk about the gas pain that you get, and not like poop gas, but the gas that they fill your abdominal cavity up with during surgery so that they can see around. I didn't start getting that pain until 3 days after surgery, and it lasted for a few days. And I remember thinking, yup, everyone was right. This is the worst. And honestly, the only things you can really do for that are just movement, which from day one, I was very adamant that I was going to be moving around. I was not going to be stuck in that bed. I was extremely strict on myself. Even if you don't feel like you need to go to the bathroom, maybe let's just get up and walk around kind of thing. And so the first few days I did try to stay upstairs as much as I could, and I walked around upstairs. And then I started going for really small walks down my block and back. Get my bowels moving, get the gas moving. They also say that rubbing, like having someone massage that for you, can help. And so you think the gas is in your stomach, it's gonna hurt there. It's intense. It's a pain that's unlike anything else you can describe. I've had pleurisy in the past. It kind of resembles that, but it's different. So when they said you can massage it out, I did try to have Mike do that for me. And the pain when he touched the area where the gas was built up was excruciating. So what I ended up doing was just really moving around. Like I would have Mike help me do arm circles, and I would try shrugging, moving as much as I could to sort of loosen it up and dislodge it. And finally it went away. I will say it's not a walk in the park. It was painful, but still not as frustrating and debilitating as the constipation. For me, that was like, oh my God. I found it just so hard to live like that. And I've had constipation problems my whole life. It's like if you're not constipated, you're having diarrhea. And it got to the point where I felt like if I put one more morsel of food in my mouth, I think that my insides might rupture. After the 5 days and I went, then I got constipated again. And so it was just like this roller coaster of shit problems that I found to be extremely frustrating. I was doing it all with the exception of giving myself an enema, and I was this close. I had one and I was ready to go, and I thought, let me just give it one more day. And so I did, and it worked. So even now, I've noticed if I'm constipated, even for like a day or two, I notice that I start having problems with my urine again. I highly encourage you to keep up on the stool softeners. If you're struggling with that, please know that I know exactly how you're feeling. It's the freaking worst. And it's harder when you've had a surgery like this because you're like, don't strain. I've got stitches everywhere internally. It doesn't feel good to push. And so as I'm pushing, I'm like, oh my God, I'm gonna rip my stitches and I'm gonna prolapse and all this stuff's gonna come out of my vagina and it's gonna be awful. That did not happen. When I woke up on morning 2, Mike was helping me wash my face and brush my teeth and do that kind of stuff. And he was like, it looks like you're really bruised all through here. What is that? And so I got up in the mirror and I noticed that there were broken capillaries all over my face. A lot in my eye socket area, even on my cheeks, around my mouth, they were everywhere. And I thought, well, that's really strange. So then I learned that it's probably related to the position that you're in when you're in the surgery. You're kind of upside down, and so all the blood is rushing to your head. They did go away after a few days. That was something that no one had talked about. The nausea lasted for a while. I really tried to not take a lot of Zofran because that's another thing that makes you constipated, and I was all about the poop at that point. Constipation, gas, talked about that. Cramping, I still had a lot of that cramping for the first 5 days. It wasn't as bad as it was when I woke up from surgery, which was a blessing. Mobility,
I was able to do most things for myself. The nurse's tip about like exhaling when you went to sit down was great. I was a little bit sore like in my vagina area. I mean, the uterus, like all the stuff that they cut out came out through that hole. And obviously I've never had a baby before, so it was like a little bit tender, but nothing crazy. My incisions, Mike had to check them regularly and they looked good. I at first was like extremely adamant that I did not want to see them because I knew they weren't big, but the thought of looking at a cut on my body like that where someone like cut into me and went inside of me just it gave me the willies. But they looked so good. I will put pictures in here. They don't look grotesque or gruesome or anything like that. So incredibly surprised at how good they looked. So they do stitches internally and then they put surgical glue on the stitches, and then bloating. I had a ton of bloating. I'm still bloated. That's gonna stay around for a while according to the internet and according to my doctor. So yeah, that's sort of how I was feeling. I will say I got to like day 7. I was still constipated, but other than that, I was starting to feel better. Showering by myself and, able to walk around, go up and down the stairs, taking it easy still, not lifting anything, not getting wild. But slowly I was able to, take my walks from 5 minutes to 10 to 15 or whatever. And so that was really nice. Just take it easy, go at your own pace. But I would say try to get up. Try to get up as much as you can, because that kind of helped me build up my abdominal strength, because for a while I felt like I had nothing. And I will say they sent me home with that binder on and they were like, you can keep this on as long as it's comfortable for you. Some people wear it for weeks. Some people don't wear it at all. And so for the first few days I was like, okay, this feels good. This feels good. And after I took my first shower on Saturday or Sunday, obviously you take it off for the shower. And I remember when I took it off, I was like, huh. It felt like I couldn't stay upright. It felt like that was the thing that was holding me together, and I just took it off and I'm gonna fall apart kind of thing. And so I found that I was super weak. And so when I would put the binder on, I just felt more locked and loaded. I think that was not good for me because I was so out of breath all the time. I was so out of breath. I couldn't even have a conversation with people. Anytime I would go from laying down to like sitting up and then standing up, I couldn't breathe. The shortness of breath that I had was pretty intense. And even now, sometimes, like last night, I got up to go pee and I'd been laying down for a while and I just got up and I had this tinge of pain and then I felt like I couldn't breathe. Like I gotta catch my breath kind of thing, which is a weird sensation, but it does get better. It does. So I felt like that abdominal binder was great for some things, but then in other ways I was like, I feel like it could be holding me back. So after I took my second shower, I thought, I'm not gonna put this back on. And that was when I started feeling better. Some people definitely need it. I felt like it was making my recovery harder to wear it all the time because I couldn't breathe. My breaths were really shallow. I don't even know how to explain it. The back pain that I was getting from laying in bed all the time was starting to become more intense than the abdominal pain that I was having. I don't do well laying down on my back. I don't like sleeping on my back. That was really hard. And so anytime that I could kind of sit in a different position, that's when I would feel more relief. With that, I would say pillows are your best friend. All the pillows that you can manage to find and gather, get them. Pillows behind your head, pillows behind like the small of your back, pillows on top of your stomach, pillows to like tuck into your sides to kind of keep you in a certain position. I used them for everything. I'm still using them for some things, and I found that to be like the best support that I could get. It even allowed me at one point to be able to sleep on my side sooner than I anticipated, which was really good because I'm a side sleeper. I also have 2 of those boyfriend pillows that have like the really high back and the little arms that stick out. I found those to be super helpful and useful. I also really loved having a pillow under my knees. Didn't matter what position I was in, that felt really good to kind of be able to bring my knees a little bit towards my stomach instead of having them stretched out. Stretching out completely was painful. Like it felt like everything was like ripping in my abdomen area. So shortening those muscles in a way really does help. Get yourself a Squatty Potty, or if you're like me and you didn't have one, I used a boot box for a while and then I ended up ordering one on Amazon, and that thing has like changed the game. Changed the game. I love it. It's great. I don't know why I was so hesitant to get one. A heating pad was super great, super helpful. And then like all your constipation gear. So anything from medicines to different foods or drinks that you can consume to help you stay hydrated. I was drinking so much water that I thought I was going to drown, but I feel like that was something that really helped me. And I will say there would be days where I felt really good, and then the next day I would feel like complete and utter garbage. And it's such a mental roller coaster that you're on. I will say I have never felt as emotionally low as I have for the past 6 weeks. I cry every day. I feel like I'm grieving. I feel like my body is just kind of foreign to me still. Not as much as it was, but it does feel a little bit foreign to me. The mental health portion of this was and still is like the biggest hurdle. Yes, there was pain, but it's sort of not nothing, but nothing compared to the toll that it can take on your emotional health. I know anesthesia fucks with you. I know that for me, I was grieving like this loss of womanhood, even though I am in no way emotionally connected to my uterus. It is still a mindfuck. It is still a loss. It's still something to grieve. It has been the hardest part, and it still is. There are days that I do feel good, but then there are days where I think, I don't even want to be here. I don't want to do anything. I can't function. I don't want to see people. I don't want to talk to people. I don't care about anything. I hate everything. Everything is falling apart. My life is in shambles. Like I plummet. And so it's not good. It's not healthy to have those thoughts. I've always felt like I was someone who could sort of pull myself up out of a dark, depressive episode, and I have not been able to do that this time. And obviously that weighs on me because I'm like, oh, well, you're not strong enough to get yourself out of this one kind of thing. I'm just being really mean to myself. I'm being really mean to myself, and it's not good. And I'm going back to therapy, and I'm really excited. And I know that it's going to get better. I do know that. It doesn't matter in the moment, because in the moment I'm like, no, this is the worst. I hate everything. My life sucks. Nobody likes me kind of thing. Everyone hates me. And then I'll come out of it and be like, wow, that was like, what a wild ride. What a wild ride that was. Why are you having these thoughts? No one is making you feel that way. You're making yourself feel that way. It doesn't matter. It's all valid. Your feelings are valid. Holy shit, just ride the emotional roller coaster, and sorry to the people in your life that you're going to be mean to, because there were times when I was like, I'm intentionally picking a fight with Mike over nothing. Over nothing. And he's been so gracious and wonderful throughout this entire thing. I know people talked about it a little bit, but this was beyond anything I expected. And my doctor never mentioned that. So it'd be really nice if they did. It would be really nice if surgeons were like, by the way, you're going to feel like the lowest you've ever felt after this for a while, but it'll get better. So let's talk about my findings, my pathology report. I think I got it back within a week. So I see an email in my inbox, and it's like, your pathology report, your results are in. So I go to my mind chart and I log in, and I'm starting to read it, and I just start sobbing because everything that I thought was wrong, everything that my surgeon thought was wrong, was 100% wrong. It was the most validating day of my life. I just cried because I was so relieved. I cried because I knew I'd made the right decision. I cried because I had hope that I was going to feel better in time. Reading the pathology report, they letter every sample that they take from you, and she took from like A to M or something. It was a lot. Every single one of them was like chronic inflammation, endometriosis, and I wrote it down. I had confirmed fibroids, which I did not know I had. I had cysts, which I didn't know I had, and I had chronic inflammation. And every single tissue sampling confirmed endometriosis. My uterus confirmed adenomyosis, and I was like, yes, yes, yes. Like, not yes that this stuff was wrong with me, but like, yes that it's out of me. Yes, I wasn't crazy. I couldn't even believe it. I was thrilled to get those really awful results, because everything just clicked. It all clicked. Oh my God, it clicked. You know, it was finally an explanation for so many of the problems that I've had since I was 11 years old. I get those results. She sends them to me. She's like, don't worry about it if you don't understand it. We're going to go over everything at your post-op appointment. So I had my post-op appointment 4 weeks after my surgery. So I went at the end of November. She took me on like a little photographic tour of my insides and pointed out all of the areas that were endometriosis that she photographed. She also said that there was confirmed endometriosis like on the other side of my colon and small intestine. And she was like, I removed that, obviously, but that could be a reason why you were having so many GI issues. They also stage you, which I did not realize. They stage it like cancer. So stages 0 through 4, and I was a stage 3. Again, validating, very validating. She said my incisions looked great. I was feeling pretty good at that point. But I did go in there knowing, oh God, I'm pretty sure I have a yeast infection. I haven't had one of those since high school, and I knew I couldn't go and like get monostat or anything because there are very strict instructions on your post-op paperwork that says nothing inside the vagina for 12 weeks. Nothing. So she took a look and she was like, yeah, it looks like you have a yeast infection. Let me get you a prescription for that. Then she pulls out a speculum and she's like, I'm gonna look. You said nothing in the vagina for 12 weeks. And I thought, oh my God, this is gonna feel awful. It felt weird, but like also sort of numb in a way, which is kind of hard to explain. When she looked in there, the vaginal cuff, this circle thing that they stitch closed, you know, where your cervix was, they have to, you know, sort of sew that up so your insides don't fall out. The vaginal cuff was failing or just hadn't healed. And when that happens, you run the risk of having prolapse, which is when things come outside that should stay inside forever. And to me, when like we talked about that before the surgery, I was always like, oh my God, that sounds awful, that sounds awful, that sounds awful. And I had still been having some light bleeding, but they said as long as it was nothing like a period, you're fine. And so I told her that during my post-op appointment. And so when she looked, it made sense to her because the vaginal cuff was failing or just hadn't healed. And so she like says to the woman in the room, hey, can you get me some silver nitrate so I can cauterize this? And I thought, cauterize? You're gonna cauterize inside of me right now. You're just gonna do that. And so I immediately started sweating profusely and I thought, I'm just not even gonna ask any questions. I'm gonna just sit here and I'm gonna let it happen because obviously it has to happen because I can't have prolapse. I can't have my intestines come out. That's disgusting. She cauterized it. It burned a little bit, but not like what I thought it would. That was like a walk in the park compared to the other things. I was this close to prolapsing, and that's been the thing I've been so worried about this whole time. So I'm so glad that she fixed it. I've not had any bleeding since then, so I definitely think it helped, you know, repair the tear. And I don't know why that happened. I don't know if maybe I strained. I don't know if it just was slow healing or what. I'm not asking all those questions. I'm just so grateful that it seems to have been repaired and I'm well on my way to recovering. At that point, she also said, you know, wait at least 8 more weeks before you have sex. The first time you have sex, it needs to be vanilla. Those were her words. And then you can have spicy sex if it goes well. And I was like, okay, but after this little incident, we're going to be waiting more than 8 weeks because the thought of that happening is just not pleasant. And here's my other tip. Don't tell people on the internet all of the horrible things that happen to you while they're still healing and haven't reached the point that you are. I get it, like let's share shit stories, let's commiserate together, but can you wait until I've gotten past these points? Because someone DM'd me and was like, when I had sex the first time, it ripped my internal stitches, and I thought, why would you tell me that? I am nowhere near that point of my recovery yet, and now I've just got this image in my mind, and I'll be celibate forever. Other things that are not helpful are telling people that you had 0 pain from your hysterectomy. I didn't have any pain. So this person told me this before my surgery, and I thought, wow, God loves you best. Happy for you. But that is not how it is for everyone. And I feel like that can really be a tough pill to swallow for someone like me or like most people who are going to have pain after a major operation. Would I do it again? 100,000% yes. Was it painful? Yes, but it was manageable. And now what I'm dealing with are just regular old little aches and pains. Sometimes I get like stabbing pains or pinching pains, I would say. Some days I'm more bloated than others. Some days I just feel like a little sore, a little tender. It just depends. Honestly, it feels like every day is sort of different, but I'm on this upward slope of feeling better as a whole, which is all I'm really looking for. I have passed the point where I would have had a period and I did not get a period, and that was just so magical. I don't have to check my bag for like extra tampons every time I leave the house. I don't have to worry about that stuff, and that is fantastic. And I can't wait until I'm at the point where all I can remember from the surgery was how great I felt afterwards, you know? Don't compare your recovery to someone else's. It is not a linear process. Healing is not linear. It goes like this, and that's okay. You know, just continue to give yourself grace and be kind to yourself and gentle to yourself, and don't say mean things to yourself like I've been doing. You will feel good when you're meant to feel good, kind of thing. And even my doctor at my 4-week appointment was like, you're feeling good now, but you'll feel good at 12 weeks. This is a long healing process, and I just gotta let my body do what she wants to do. I'm sort of surrendering myself to my body, which took me a while to wrap my brain around. Maybe I'll actually want to do things because I'll have energy again. And that's the other thing. I was so prepared to feel so tired, but I think I had a different reaction because I was so tired before my surgery. I would sleep all the time. I would sleep all the time, and I would take naps and just feel like I couldn't function. I don't have the ability to stay awake. My body would crave rest. And I feel completely different than that now. And I'm only 6 weeks out, and I feel like I did this flop and maybe clearing my body of this bullshit that was just causing me all of this chronic pain and stress and depression and exhaustion. That stuff's gone. Now my body can have the energy level of a 33-year-old woman, a 33-year-old healthy woman. That has been really lovely. I occasionally will take a nap, but it's just because I want to. Like, oh, this is cozy. Let me just take a nap for fun. Before, I was taking a nap out of necessity to function, and now I don't feel like I have to do that, and that is so exciting. That's so exciting. So I'm trying to like really appreciate those small wins, although that to me is a big win. So just know that it's okay if you feel exhausted. It's okay if you don't feel exhausted. I feel like no two people recover the same way, but I highly encourage you to ask questions either to your doctor or to people who've gone through something similar. For me, that was so great. So many of our Instagram followers had gone through the same procedure or had had one or the other, like had had a hysterectomy or had had excision surgery. And just being able to talk to them and bounce my thoughts and my feelings off of them was so helpful and therapeutic in a way. I still am having conversations with people. One woman in particular had a hysterectomy 3 weeks before me, and she's local to my area, and so we were constantly messaging back and forth, which was really great, just to commiserate with someone who gets it. There are support groups out there. There are people on YouTube. There are people on Instagram. Tons of endometriosis accounts that you can follow. This process would have been so much harder had I not had that community of people that I felt like I could kind of reach out to for help or guidance. And so I'm very grateful for that. So yeah, other than the occasional twinges of pain and bloating and like sometimes still having some difficulty with the urinating constipation thing and like the emotional train wreck, apart from those things, I'm feeling pretty good. I'm happy. I'm happy with my progress. I'm not trying to compare myself to anyone else. I feel like despite my very thorough outline, not very thorough, I was all over the place in this video, and so I hope that you did find it helpful. Like I said, I'm an open book. I am not half of our time of the month, and I didn't get this surgery to not talk about it and spread the word and the awareness. Endometriosis and adenomyosis are extremely underfunded in terms of research. I would love to see that change. I feel like now that I've had it done, I feel like everyone I know is either getting an excision surgery or a hysterectomy or both. I feel like it's like the thing right now, and maybe that's a good thing. You need to find a good medical team that, you know, will help you arrive at the best decision for you and for what you want. I never wanted children. It was a very obvious thing for me to be like, okay, let's get the uterus gone kind of thing. Do what's best for you, and I hope that you find a good team. Like I said, you can always reach out on Instagram. You can send us an email. You can leave it in a comment. I will try to monitor this very closely because I do want to be helpful, and I do want to share all of the things that
maybe I didn't know, no one told me, or give you some validation that it's okay to feel this way. Thank you so much for watching. Thank you for following along in this series. Like I said, I hope it's the last part. Thank you for all of your tips and suggestions and well wishes and just like great thoughts and prayers, and it's all been very much appreciated. You have no idea. It has been like having my own little cheerleading squad while I went through this, and I'm forever grateful for that. So thank you, and I hope to do that for you if you need me. I will be your cheerleader. If I think of anything else, I'll try to like leave it in a pinned comment down below so you can check that out. Otherwise, you can feel free to follow us at Our Time of the Month on Instagram. So to recap, my biggest takeaways would be prepare for constipation, get a lot of pillows ready, stay up to date on your medications around the clock for the first couple of days. Make sure you're moving around as much as you're comfortable with to help dislodge that gas. Give yourself grace and compassion. Do not compare your recovery to someone else's. Everything that you're feeling is completely valid. And I know when people are like, oh, that's normal, that doesn't sound good. Like, it doesn't make me feel better when someone's like, oh, that's normal to feel that way. No, I don't want to feel this way. And I don't care if it's normal. It's not normal for me. So I don't want to feel it. But it does get better, and it will continue to get better. And that to me has just been the thing that I'm like really trying to fixate on. Look at how far you've come over these past 6 weeks and just think about how much better it's going to get. Sending you lots of love. If you are going through something like this, I hope that you found this helpful. Please reach out to me with any other questions or comments or concerns. And I hope you guys are all having a wonderful holiday season. And I will see you soon. Bye.